Well, I have a parting group of VCOM students. We have Courtney and Katie, Liz and Mike from two different campuses, one Spartanburg campus. Liz and Mike are from Spartanburg campus. Courtney and Katie are from Blacksburg campus. And just finishing up their stay here. This is December the 10th, and they fly out tomorrow. Just want to kind of give your impressions about what it's been like to be here in this program. And we'll talk about just some specific things that y'all did that you felt like were fun or enjoyed and that kind of thing. Okay. We'll just go from left to right. What was your, my left, what was your kind of your overall feelings about this experience?
Really loved this experience. There was a lot of different aspects that I loved. The clinic was really great because you got to deal with patients and deal with their chronic conditions, and they can come back for continued care, which was really great. And then the hospitals were definitely an eye-opener, and you kind of learn what they're missing in parts of the world that we know we take for granted in the States. So that was interesting to see.
For example, what do we take for granted?
Just having the ability to have different antibiotics and different medicines that can save lives in the States for stuff that's very treatable. A lot of things they can't afford here. So a simple antibiotic or anything they come and they just don't have it available. So that was kind of sad to see. But it was really great working with the doctors, the medical students, and the residents. They were just really eager to help us, and they were, even though there was chaos going on in the hospitals, they were always ready to show us and help us learn the medicine. And then I loved being on the Baxter Institute on this campus, and even at graduation we got to meet a lot of great people who were just really, really caring people, and they really, really wanted to help the people of developing countries, so that made me really happy. And the students were amazing here. Everyone was so friendly, and they offered to practice Spanish with us, and it was a really good experience.
Okay, great. Mike?
So, say I came in a bit overwhelmed. I'd never been somewhere with so much ambient noise and getting used to just not speaking a language and having to go in and see patients. But the people here are very caring, very genuine. I mean, we stumbled through Spanish and they worked with us every step of the way. I mean, I took medical Spanish and I had 2 years of Spanish 10 years ago, and was able to communicate with patients, and they were just very, very willing to speak slowly and listen to our horrible pronunciations and our barbarian Spanish. But the clinic was great. It was great to have the opportunity, like Courtney said, to interact with patients on a daily basis. The staff are amazing. They do a really great job. They're very compassionate. They're very will do whatever for the patients. But I agree, it's hard whenever you practice mission medicine that you have to kind of understand that there are limitations to what you can do. As far as you're limited with the medications, but you're also limited with the tests. We're used to oh, we think they have this, let's run all these tests. Well, here it's we think they have this, we got to figure it out clinically. So it's definitely a challenge, but it was a great experience, something we'll definitely carry with us. I know I delivered my first baby, which I will never forget, which was really a great experience and something we hope to continue to do.
How much medication did the woman have?
None.
Say it again.
None. We only get epidurals for C-sections. The women that have natural births are going at it all on their own. No family around. No medications. It's just them and a student and maybe a doctor, but it's medical students delivering babies. So very different than what we're used to. And a lot of facilities are outdated. I think that's the big difference between where we are in America and here too, is we make everything look so flashy and nice and new and clean, and every time a woman goes into a birthing suite or something, it's it's a brand new room for them. But here it's taking care of the masses as fast as they can and as many people as they can possibly help. And it was an eye-opener, to say the least, but definitely they do some great things here. It's just there's a lot of differences between what we're used to and what they do here.
This is third world, and this is probably the bottom of the Central American countries as far as what a patient might find. You were in San Felipe, and you were also in Hospital Escuela. You had those two different kind of experiences. Well, that's good. We'll go to Katie.
Oh, okay. I guess the really good thing about coming here is that VCOM has a working relationship with Baxter and gives the students a place to stay. We can walk to the clinic every day and get that experience, as well as having that partnership with the hospital. So we get to really see the day-to-day of the people in Honduras and understand what they really have to go through and the hardships they experience. It was really nice working with Dr. Ziamora. She's a great person, a great influence, and someone I really look up to.
She got pretty good English, didn't she?
She does. It's very impressive. And she's always willing to help us and listen to what we have to say, and kind of guided us through our experience in Honduras. So that was nice to have her. I guess one of my favorite experiences though was in San Felipe. We were able to assist in a C-section, the first assist, and it was very memorable. It was my first time in an OR ever, and not a person in the whole OR spoke English. So it's nothing like having the nurses yell at you in Spanish to not drop your hands below the sterile field. So that was an experience in itself, but I really enjoyed my time here. It was great to see how graduation worked and where all the Baxter students were going after graduation, and I think it's amazing what you're doing here. So,
Thank you. Last but not least, Liz is Mike's wife.
Yeah.
To make our connection here.
Yeah, and we've really enjoyed our time here. It has been overwhelming, but it's something since we got married, or even before we got married, just as a couple, we thought was really important and was something we wanted to share in together, serving and helping people. And it's definitely been an awesome experience to do that. And every day at the clinic when we go in, we've done triage, and it's just been a cool experience to be able to talk with the people and work with them and improve on our Spanish skills, hopefully. Sometimes I'm not sure, but the people were really great about communicating back, and it was really neat to see the relationships that the people had built with Adita and Dr. Ziamora and the people in the clinic, because you could tell a lot of them when they would walk in, they would hug or exchange how things were going, and you could just tell that it was more than just medicine that they were getting from the clinic, which I thought was awesome and really cool to be a part of. So I hope we can continue to work on our Spanish skills so we can become more of a part of that if we return back here when we go into the communities, because it seems really important to the people and really impactful on their health, because you could see a change in their disposition and how they were when they interact with those people and get really excited. And we had a few patients like that who were really excited to have us, and when we would communicate and when they'd leave, they'd give us hugs, and the kids were amazing. They were all really sweet. That's at the clinic, and the children here at Baxter, we would walk in the afternoons and go through where the children lived in the Marriott area, and they were always so sweet and talking to us and saying hello and asking our names, and so it was really neat to interact with them in that way. And Mike would play with them some and chase them back and forth, and it was just really neat because it was just a fun experience, and it's cool to see with the graduation and all, and how the families here with moving from totally different countries, coming to a completely new place, how happy and content they are with not a whole lot, what I wouldn't consider a whole lot. I don't know. For them, it seems to be a paradise, which is definitely interesting, because to us it's been an adjustment in the other direction. But I think that's a really good part of this experience, to kind of go back to a simpler way of living and being just with what's you know, around you here, like no TV, limited internet. Like you may have internet, you may not. You may be able to download a movie, you may not.
You might have electricity or not.
Yeah, and it adds a different perspective to things, and it really makes you. I mean, that's something I've liked about like being with Mike. We have much more time to like talk and communicate compared to in the States. It's like you get home and you turn on the TV, or you go check your email or your Facebook or something, and you're always in that zone. So that's been really neat. And then the hospitals, like they said, were very different. Gives you a great appreciation for the things we have in the States. We've enjoyed all the cultural experiences we've had, taking Spanish classes 3 times a week with Blanca really helped us have a foundation of understanding, speaking Spanish. So, and then going out and seeing the little boy, Christian.
Yeah, share that experience. That was quite a unique, hit the papers and
Yeah,
TV
yeah.
and all that kind of thing.
Well-
Give us a little background on how that all, what the situation was and how that kind of developed.
Well, honestly, it was kind of crazy because it was one of the first few days that we were here. Mike and I think we were heading back to the clinic for the afternoon, and Marcos was like, get in the truck, and we were kind of like, okay, like, we guessed Dr. Ziamaro would have told him because we were pretty sure that's what he was saying. And so we got in the truck and we just took off, and he told us we were going to see a little boy who didn't have any parents and was taking care of his siblings, and that's all we could really understand of it. So we drove a little while, and this with traffic and everything being crazy, it's probably only like 15 minutes away, but I felt like it took like 45 minutes to get there.
Probably did, yeah.
And so we start noticing we're getting into a less nice area. We kind of ride in, and I feel like kind of when you start to get into the area, there's like this, I don't know if it was trash or what, and people kind of homeless, living on the side of the road, and just going through it, and then you go up, like above everything, and you feel like you're kind of on the side of a cliff, and you turn.
And you are.
You are on the side of the cliff, but it's also people's homes made out of
Metal, like anything that they could find.
metal, wood, anything they can find, dirt roads, just like skinny dogs and animals everywhere. The kind of thing I feel like I've seen on a movie, but never seen in real life before.
Yeah.
And it's shocking. Like I still don't really know what to make of it and how to like take it all in.
Yeah.
Like it's something you think about time and time again, and it's kind of like, is it even real?
So the background with Christian, he's a 14-year-old boy. His mother passed away in June, I believe, of stomach cancer, and their family spent every dime they had trying to treat her. They thought they had it under control, and then they found out the cancer had spread wildly. She had no chance. So when his mom passed away, he being 14, he has 2 younger siblings, and they were quite a bit younger, probably like 10 and 6, somewhere around there. He decided he was going to quit going to school and make tortillas out of their house to sell so his siblings could continue. And it really kind of takes me back and makes you think, like, if I were in that position, like, I can't imagine what I would do. But he was so mature, just so like collected for 14, and he had been doing this process for a few months already. His brothers continued to go to school. He had an aunt that lived next door. They kind of checked in on him, but they basically did their own lives. 3 of them lived in like a 10 by 10 shack with no door. All it had was a few beds and a dresser, and then he had a little kitchen outside of there, and that was what they had.
An outhouse?
And that's it.
Was it even an
It was
outhouse?
an outhouse.
It was an
Yeah,
outhouse.
There was an outhouse right outside their door. And just to see that they had endured tragedy, had so little, and they still like were some of the most content people I think I've ever come across with. I mean, this boy, you would have never guessed he had so much stacked against him. no parents around, you know, providing for his entire like family. It was remarkable. It really was, to just see how they continued to endure. And then we were lucky that we went out the first day, and then the 4 of us got to go the second time. And we went to like a local center, and some of the local churches pulled together and they donated. They were actually going to build them a new house. They were going to provide education for the 3 of them so they could continue to go to school. And they're going to provide food to the family. And then I think the clinic is going to help them with health care. So get them in to get checked up and taken care of. Which it was amazing. The aunt was elated.
Yes.
She
So
told us.
happy.
I felt so bad. She told us like the whole story in like lightning fast Spanish.
Yeah.
We had no idea what was going on, but she just
Was so happy.
she talked for like 30 minutes to us.
pretty much.
It was great to be involved and to see that whole story.
What would you add to that, Courtney?
It was just, Mike pretty much said it all. It was really an amazing experience, and it was really great to see the community pull together and help them out. So it was just really, it was a great experience.
Probably good when those kind of things happen with future groups, that somebody has a little hand cam, a little camera, video camera to take, because you know that's terribly difficult to describe.
It is.
Even photos don't describe it, but still, at least they help and all. What other kind of unique experience did you have, Courtney, or any of you, that you'd like to share? I said Courtney because you have not talked as much.
I think probably the thing that I think kind of touched me the most was at San Felipe. Just seeing the moms, they don't have clothes, they have no blankets, no sheets, no socks on.
This is a hospital, San
This is
Felipe.
the hospital, and then it's when the moms go to give birth, and they just really don't have anything at all. They barely had gauze to take care of them. They had one of the women delivered, and she had no clothes on after. They didn't even have a sheet to cover her. So it's really, really heartbreaking. So it's actually, Katie and I had spoken to our campus and Dr. Dean Suffin, and we're gonna actually go shopping for the moms when we get back to the States and
Good.
send stuff down with them. So that's something I definitely want to keep up with. And some of the medical students I met, their moms work there. So I told them to just let me know what they need, and we're gonna send it and make sure that the moms get taken care of. So I think that was probably my, I don't want to say like favorite experience, but probably the thing that like touched me the most. So and just well, probably the one story was I had a 17-year-old patient that was delivering her baby, and she had a really bad tear after the delivery, and she was in so much pain, and she was 17 years old, and she has no family there. So I pretty much just stayed with her the whole night and made sure she was okay and calmed her down. And when finally she was well enough to leave, she just came and gave me a hug and a kiss, and told me, "Thank you, doctor. Thank you, doctor." So I thought that was really fun.
Nice to be called a doctor.
Yeah.
Not
Apparently
too.
that's what they say here. So. Yeah.
Other kind of unique moments or experiences. You got anything, Katie?
I guess one thing we haven't really talked about was our experience today in the pediatric oncology unit. Going in there, I had no idea what to expect based on like what I had seen so far at hospitals. Literally just the war scene that hospital has, but we walked in and it was just like amazing. Like the kids looked so well taken care of. They all had a mom sitting right next to them. The doctors were so friendly and nice and caring. He was wearing like a Santa hat, going up to each kid and smiled and hugged each one, and it was just like, I guess the pediatric oncology unit gets its funding from St. Jude's. So, they have like better quality care for the kids, and they are able to consult St. Jude's to get better ideas for drug regimens for them, and all the kids were in good spirits. So it was kind of like, a happy ending to the trip.
Yep.
So that was a really good experience.
The rest of the hospital is very different, isn't it?
Yes, it is extremely different.
Different in what way?
It's just, you walk in and it just automatically stresses you out. It's not like the the control we see in the hospitals in the United States. They're very quiet and you don't make a lot of noise and you don't stir up any emotions. But in this hospital, like I remember the first day we were working in the ER and someone had passed away and they were rolling the body through the ER waiting room. And just the family was like crying, like just expressing so many emotions, like to a stretcher, you know, a body on a stretcher. And it was just, you know, kind of like rips your heart out, like seeing something like that. And just things we would never see. Like, I don't think I will ever see something like that in my life. So it's experiences like that that you kind of pull away and you makes you want to come back here and help whenever like we get our degree and can like really make an effect here.
So you are coming back?
Absolutely. So,
Well, we would certainly love for you to come back.
oh,
Appreciate very much your time and what you put into here. Tell a little bit about the setup here on campus and how, again, thinking in terms of future students, what might they expect when they arrive here?
On campus, it's really well taken care of. The students are incredibly friendly. They want to interact. I think they were hesitant the first week or two,
Yeah.
because I think they were like, these white Americans don't speak any Spanish, like what are we going to say to them? But they definitely warmed up. But I felt like that in general with a lot of the Honduran people. They were kind of slow because they were like, you're different, like you probably can't talk to us. But once we reached out and started speaking a little Spanish, it got a lot better. The one thing that we found is a challenge with living on Baxter is that because it's in a bad area, you're confined to kind of where you live. So it brought its challenges as far as, you know, we were limited in where we could go, but the grounds themselves were beautiful. We loved to be able to take walks in the afternoon, and we found a nice little trail to take a walk on. And I mean, it was really nice, and it was great. You wake up in the morning, if you stay in the VCOM apartment, you walk 100 feet and you're in the clinic, you see patients, and then you come home. You have the ability to just kind of go back and forth. And like I said, the people here have been outstanding. I've never met a group of people that have been so welcoming to outsiders than what we found here.
Oh, great.
And the whole country, pretty much. Everybody that we've met has been just so nice. So we loved it.
All right. So you went out on some adventure stuff, unique trips, beyond the medical kind of a thing. Anybody want to share about going off to, I think, La Tigra, the rainforest hike and that kind of thing? Any sharing along that line, or any of some of the other stuff you might? Wonderful zoo.
Sure. Well, our first weekend here, we went to La Tigre. It was really, really pretty. It was a really nice hike. I think we all enjoyed it. There was some little waterfalls and caves and
got a little lost at one point.
yes, it was scary that way.
Yes, that's how we figured it out with my compass.
Yeah. And then when we got towards the end where we were supposed to be meeting Marcos, we were a little confused because we knew we were trying to get to a village, but we weren't sure. It seemed like we were more on roads than on trails, but we made it.
We kind of like looked through the trees, and Marcos was there waving at us.
Yeah, that's when we knew we didn't blend in, because we were probably like a mile away, and he was like, and we were like, oh, he sees us.
Marcos is the driver.
Yeah.
And kind of hangs out at the clinic and does various things around there. A skinny guy, right? I don't think you want to have.
Somebody must be feeding him.
No,
It comes down.
he's a big guy. Good to have around in case there's anything would go wrong. He'll take care of you, I think.
Yeah, he's been great. We've all loved having him drive us around. In fact, today, the other mission group that came had him, and we definitely missed him because we're used to him. We got done at the hospital at 1 and came out, and we're like, where's our ride? It showed up on Honduran time at 1:30.
Yeah.
One of the best things is just leave your watch in your
Pretty
pocket.
much.
Exactly. So, yeah, I think we left at 1 on the dot, and
Yeah.
we might as well have waited a little while.
Yeah, yeah,
That
yeah.
was a big adjustment here because I know the first few days of the clinic, I think we were driving Dr. Ziamara nuts because she'd be like, come back around 1. And to her, that meant 1:30. So we would come back at 1 sharp.
Yeah.
And she'd be like, why are you here already? Or she just wouldn't be there and we'd just be sitting there. So it's an adjustment to get
Towards
used
the
to.
end, she started saying specifically 1:15, 1:30. Okay, guys, don't come back right at 1.
Yeah.
There's a definite difference in attitude toward time. Yeah.
Absolutely.
And then we don't talk about Blanca.
Yeah. We,
Time.
Did she give
Blanca, actually, we didn't have any problems with
Yeah,
Blanca being,
that's really
she was late the day we went off campus, but she had, I mean, her mom
That
was
was,
in
yeah,
the
that was,
hospital.
yeah. And there's
Good.
traffic.
Good,
Um,
good.
But that's something that I would strongly recommend for any students that come down in the future. Blanca was incredible. She was our Spanish tutor. She worked with us anytime we wanted. I mean, from knowing no Spanish to anyone that knows like advanced Spanish, she was willing to work from slow to fast. She was amazing. And then she took us for an outing too, which maybe one of the girls that want to talk about. We went to see the Jesus statue in the zoo.
Yes, that was a fun day. It started off, we got espresso Americana, which for anyone who comes, you must go to espresso Americana. It's really good and it's safe, even if you get the icy kind.
For coffee.
Yes.
For coffee, yeah. And then we went directly to the Christ statue. We saw that. It's like huge. I was like surprised it was that big. And there was a commercial being filmed at the time. It was like, I think some famous like Honduran soccer player. And they had like 1 million soda cans for him. So it was a Pepsi commercial. So we walked past the Christ statue and kind of got a good glimpse of the area. It's beautiful. We were wondering why there weren't more people there because it's just such like a nice area.
Which overlooks the city of Tegucigalpa.
Yes. Yeah, we got some great pictures of the view. And then on our way back, we stopped at the zoo and saw some animals. One which included a 3-legged cheetah. Yeah, we're not quite sure how we lost them.
Yeah.
He got like sick at some. He was apparently had 4 legs when he came there. He got like a disease and they like amputated
yeah.
his leg.
But
He was very photogenic. He came right up to the screen.
Yeah.
And posed for us on a log, so I got a really good picture of him. And there was a good number of animals in there. Their cages were like a little small, so that was the only like really upsetting thing about it. But it was a good experience.
Maybe a little bit on the lean side too, right?
A little bit.
Yes.
Okay, just leave it wide open if there's anything else you guys want to share.
I just think we all had a great time and hope we're gonna come back home as soon as we can.
Good.
Yeah, and I think, I mean, it was great too, being able to do, like the girls said, like going to Baxter's graduation and just feeling like we felt like we were a part of everything. We felt like we were part of the culture, but then be able to get involved in like school activities and go to like, Sunday, we got to have a party with all the children from Baxter, which was a blast.
Yeah, that was fun.
The kids were so fun. We had a piñata and limbo, and I had a little girl that I played with for about an hour, Hennessy's.
Oh, yes.
She's
It's cute.
Very, very sweet. So it was a lot of fun. Like they've all said before, it was an outstanding experience, something that we look forward to doing again.
Okay. Alrighty. Thanks for coming. We hope that you will indeed come again.
thank you.
Thank you.
Yeah.
Yeah.